In this section, we'll look at 5 issues: how not to die suddenly of undiagnosed heart disease, how not to die slowly and painfully of chronic progressive disease, how not to die of an infectious epidemic, and what about our future generations, how about our children. And we'll also see what we can do for our elders, our parents, how about increasing their quality of life. We welcome Dr. L.S. Jayachandran Vivian, MBBS D Ortho from CMC Vellore, FRA CGP. He has a scope certification from the World Obesity Federation. He's a member of ANZOS, the Australian New Zealand Obesity Society. He was an observer of Dr. Jason Fung in his clinic in the reversal of diabetes and management of obesity. Welcome, Dr. Vivian. We are happy to have you for this interview.
It's a pleasure, Tina. Thank you. Thank you for having me.
Okay, so let me go straight to the questions. How do we know if we are healthy? How do we not die of undiagnosed heart disease? I'll split these questions in 2. The first part of my question is, there has been a sudden rise in heart attacks. People are just dropping dead, Relatives are saying, oh, he's young, he's just 40, he's just 45. We didn't know he had heart problem. He just was taking basic medication for either blood pressure or diabetes, and then suddenly he died of heart attack. David Bobbitt in the documentary movie The Widowmaker says about heart disease, the first time you know you have the disease, you're dead. The first part of my question is, how do I know whether I have heart disease while I'm still alive? The second part of my question is, I remember the incidents of one of my relatives going to the doctor and coming back. So when they returned, I asked them, so how are you? How did the visit go? And the person said, oh, everything is fine. And then they added, saying the doctor has changed the dosage of this medicine and has increased it. And he said that this medicine is not working, so they're going to try a stronger drug. So I was like, so this person comes back with an increase and a different medication. So how does that mean he or she is fine? How is that healthy? So what is healthy? What is fine?
That's a very good question. When we look at a person, there are certain things we can look and see. These are all markers that there can be an underlying problem. Things like skin tags, especially around your neck, shin spots, edema of your feet, acanthosis nigricans. This is a conglomeration of dark spots that come around your neck, an increased abdominal circumference. They just look big. An increased neck circumference, and xanthomas. They are small yellow fat-like deposits around the eye. These are things that you can see, and you can tell the person that they have an underlying metabolic problem. The next thing you can do is to do a few first level tests. You can do some measurements and then see if you are outside of the normal or recommended values. If you go to a doctor, they'll do your blood pressure. You can check your cholesterol. And by cholesterol, I actually mean just not the total cholesterol, but actually the HDL cholesterol and the triglycerides. Third is your HbA1c. Next is HOMA-IR. It's a complex calculation that is taken from your fasting blood glucose and also your insulin. It's just not adequate if you do just a fasting blood glucose. You also need to do your insulin levels, and I'll explain why. Going through each one of them, your blood pressure, your doctor measures your blood pressure. The normal blood pressure is supposed to be 120 systolic and 80 diastolic. If you're within those numbers, you're fine. If you're outside of those numbers, if your number is more than 120 systolic and 80 diastolic, then your doctor will see what causes that high blood pressure. It could be due to smoking, anxiety, obstructive sleep apnea. Some medications can cause high blood pressure. Kidney issues can cause problems with your blood pressure, and metabolic health issues. Once you know you're outside of the normal recommended values for your blood pressure, then that will trigger your LCHF doctor to go and do some more testing on you. The second test is the cholesterol. As I mentioned, it's just not the total cholesterol, it's the HDL cholesterol and the triglycerides. The normal for a triglyceride is somewhere between 70 to 100 milligrams per deciliter. Optimal is to be less than 70 milligrams per deciliter. Anything more than 100 milligrams per deciliter is high. The HDL, it's supposed to be more than 40 milligrams per deciliter in men and more than 50 in women. So if you have a combination of high triglycerides and a low HDL, then that's another abnormal test pointing towards metabolic disease. The third one is your HbA1c. The HbA1c is a 3-month average of your blood sugars. Less than 5.4 is considered normal. 5.5 to 6.4 means two things. It's either pre-diabetes. It also puts you at increased risk for cardiovascular disease. The next is a couple of blood tests. One is something we know very often. It is the fasting blood glucose. You check your sugar levels early in the morning, but at the same time, we also do an insulin test. Look, some people may have a fasting blood glucose that is normal, but what we do not know if we don't do an insulin test is to see how hard your body is working and producing insulin to maintain a normal fasting blood glucose. So just a fasting normal blood glucose is not a very complete test to tell you how your body is functioning. You need an insulin test as well, the fasting insulin, and combined with this, you can calculate your HOMA, or it's your homeostatic mechanism of insulin resistance. That can tell you whether you are insulin resistant or not. So these tests are indicators of how healthy you are.
Okay. So these are numbers that one should achieve without any medication, right? Because I've heard people say, oh, I'm fine, my sugar is normal, my BP is normal. And then in the course of the conversation, they say, I'm having this drug to reduce sugar and this drug to reduce BP. So the point of these tests is that you should have them without any medications. Am I right?
Yes, that's the optimal place is to achieve these numbers without the use of any medications, which is the best. We try to achieve this in the long run with an LCHF lifestyle. I just want to explain this with an analogy. If somebody says, okay, this is the normal numbers you want me to be under, and I am able to achieve those numbers with medications. So what's the problem? I'm still normal. Okay, now let's just take and assume somebody has blood pressure that is caused by smoking. So you can take some tablets to reduce your blood pressure and continue smoking, but you're going to end up with the side effects of smoking. Lung cancer can be down many cancers can come from smoking. So just having a normal blood pressure, taking a blood pressure medication when smoking is the cause, and then satisfy ourselves saying my blood pressure is okay with some medications, it's not a very good approach to good health.
It's interesting that you mentioned the HbA1c in the context of cardiovascular disease risk, because we usually associate it only with diabetes and blood sugars. So could you elaborate a bit on that?
A diagnosis of diabetes, cardiologists consider it as equivalent to having actually a cardiac event, something similar. So diabetes is actually considered as a cardiovascular, it's a huge cardiovascular risk factor. And pre-diabetes means a patient is not only at risk of diabetes, they are also at risk of cardiovascular disease. And that's why that segment where somebody is pre-diabetic also puts them at cardiovascular risk. So the patient can just not satisfy themselves saying, oh, I'm just pre-diabetic. Actually, they are also pre-cardiovascular disease.
Oh, wow.
And that's at those numbers.
These tests that you mentioned, apart from the blood pressure test, it's just a one-time simple blood test, right? You go on an empty stomach for 8 hours to any diagnostic lab, you give a blood sample and head back home. There's no need to return to the lab after 2 hours of eating, no need to hang about in the lab, no other complicated procedures involved, right? So it's pretty simple.
Yes, look, when you take these tests for your metabolic health, it's you don't need to do your fasting and your postprandial. Those tests have their own values in different clinical scenarios for the progression of diabetes or to dose your insulin or check for gestational diabetes. So those tests have their value, but just for screening purposes, these tests give you more value for your money and give you a better picture of your health. So all you need to do is just go get these tests. Also ask the lab to report these tests, the results of these tests back to your LCHF doctor. So they can put it, store it in their software, and then monitoring it in later as you progress in your health journey becomes easier, and you have a visual pattern of how you panned out as the days go by.
The basic level 1 tests are slightly different from the ones that are usually recommended. For example, the insulin test. So can you explain that?
Okay. I just want to again explain this test with an example. Okay. We all know when you put a duck in the water, it swims. It goes from point A to point B. What we do not know is how fast or how hard the duck is paddling under the water due to the force of the stream of the water underneath. All we see is the duck going from point A to point B. So that is what your fasting blood sugars show. They just tell you that you're normal, but it's your fasting insulin that tells us how hard the body is struggling to maintain that normal fasting blood sugar. So I would treat a fasting blood sugar normal value with a little bit of pinch of salt. I would always say, okay, this person is having a normal fasting blood sugar, but underneath all this, is their body struggling? Is there too much insulin resistance in the body? Is the body pumping out insulin to maintain this normality?
And that's why we use the fasting insulin.
That is why fasting insulin test is used along with a fasting glucose test, and the HOMA-IR value, it computes your insulin resistance. Insulin resistance is the precursor to diabetes. Somebody who is insulin resistant are on the journey and going down the road to meet their friend called diabetes a few years later.
And probably also,
and once you get diabetes, as I said, there are a few other friends down the road, cardiovascular friends as well.
so what do we do next? How do we know whether a person needs to test for heart disease risk?
We need to do 2 tests to further risk stratify ourselves in regarding to cardiovascular risk. One is the coronary artery calcium scoring, and the other is the stress echocardiogram. These tests should be strongly considered if you have one visible marker, any of the visible markers, especially increased abdominal girth or increased neck circumference or xanthomas, and one set of high values in any of these tests. If you have high blood pressure, you are at risk for cardiovascular disease. If you have high triglycerides and a low HDL, again, a deadly combination in the cholesterol, that should provoke you to do the second line test, or the HbA1c is above 5.5. And if everything is normal and you're a smoker, you put yourself at increased risk for cardiovascular disease. So you should have the second line test to see what's actually happening in your heart.
Many times I see that patients are advised only the stress echocardiogram, the treadmill test, but not coronary artery calcium score test. Should the CAC scan be recommended as well, apart from the treadmill test, and why?
When you get a stress echocardiogram, you're put on a treadmill and they see how your heart is functioning under stress, just after stress. Now, you can only see these changes if the coronary artery, that's the artery that supplies your heart, is blocked more than 60-70%. It's a test of how the heart functions. It is incomplete if you don't do a coronary artery calcium score, because the coronary artery calcium score tells us the buildup of calcium in plaques. And as soon as the coronary artery starts building up calcium plaques, the coronary artery calcium score starts rising. So it will even find out blockages in the early stages. Taking just a stress echocardiogram is actually an incomplete test to risk stratify you in terms of cardiac diseases. The traditionally used Framingham risk assessment tool is not complete. It's not a very good tool, and it misses many key issues, especially hereditary and genetics. And it was a good tool years ago, but it's outlived its usefulness now. There are better tests that will risk assess you for cardiovascular risk. The stress echocardiogram is a test that depicts the functioning of your heart. The calcium artery scoring is a test that depicts the form of your heart, form and function.
Oh, wow. Okay. So to know both the form and the function, then we need to do both tests.
Both the tests.
So that is why a lot of people miss out. They perform well on a treadmill test, but then suddenly they get a heart attack and nobody knows that they had heart attacks in the first place.
Yes. I would consider doing only one test and not the other is incomplete.
Okay, so what does one do if the reports show abnormal values on the second level CVD risk diagnostic tests?
Okay, once you have an abnormality in your second level tests, especially your stress echo or your coronary artery calcium scoring, the CAC score actually is, there are various numbers attached to it. I think it's this time your LCHF doctor and your cardiologist will coordinate, and they may end up advising either a formal angiogram or a CT angiogram.
Okay.
At this point, I would like to stress that anytime you visit a specialist and get these third level and diagnostics tests done, it's always better to go back with the reports back to your LCHF doctor, who will coordinate your care.
Okay. How about people who are known diabetics? I've heard people say, I only have diabetes, I don't have heart problem. So what about them?
As I told you earlier itself, the diagnosis of diabetes is considered equivalent to a cardiac event by some cardiologists. So if you have diabetes, you have increased cardiovascular risk. Now, if you look at the root causes of both of them, the root cause of diabetes is insulin and leptin resistance, and both are inflammatory conditions. And the same goes with cardiac disease, where there's an inflammation and the plaque is a result of the inflammation and injury to the inside of the coronary artery. So both are related one to the other, and both have a common underlying problem, which is increased inflammation. So if you are a known heart patient, test for insulin resistance. If you are a known diabetic patient, test yourself for coronary artery diseases. Start with the level 2 test, and then if necessary, level 3 test in consultation with your cardiologist. Apart from diabetes, there are other conditions that are also risk factors for developing a cardiovascular disease and ending up with a cardiovascular event. Gout is one of them. A strong family history of heart attacks, deaths in a young 50, 60-year-old person in the family, smoking, recreational drug use, alcohol use, they're all risk factors for cardiovascular diseases. So if you have any of them, it is better that you get risk stratification for cardiovascular diseases by doing both this coronary artery calcium score and the stress ECG.
So how does one proceed if they have dangerously high values in these tests?
Look, dangerously high values are causes of concern. It has to be attended quickly by your LCHF doctor and your specialist. For example, if there is a very high degree of heart blockage, your specialist may want to put a stent in or do some, CABG or something like this. It's an open heart surgery. If your sugar values are very, very high, your LCHF doctor may decide to give you insulin shots in the short term to get you out of the danger first. In the long term, we can then make lifestyle changes and dietary changes to address and mitigate these risks and actually aim for reversal of some conditions as well.
Okay, say suppose one doesn't have these dangerously high values and may not require immediate surgical intervention, operations or something like that. Can insulin secretion be reduced? Can calcification of the heart be reversed?
Yes, look, dietary and lifestyle changes can cause a huge change in insulin secretion and insulin resistance. And similarly, you can also actually reduce your calcium plaque by a very good LCHF lifestyle, LCHF food, intermittent fasting, and proper supplementation. It is possible, definitely possible, to stop the plaque formation from growing and becoming bigger. And in certain conditions, you can actually reduce the plaque formation. So it is possible by lifestyle changes, along with what your doctor may want to do initially, if there is any need for acute intervention.
So what if a person just has, just one or two visible markers, tests are fine, or maybe they have high values in just one test, or they have minimally above normal values in two tests. So if it doesn't seem like the danger is too high, but supposedly minimal, then what should a person do?
If your results are deemed by your doctor not to be something that needs to be either investigated further or attended to on an urgent basis, they can always advise you to change your diet and your lifestyle. You can check after 3 months. So go to your LCHF doctor. A visit to the doctor may be helpful because they may be able to see things that you don't see, and they may be able to put combinations and figure things better. So I would suggest if you get these blood results, just don't look at the values and try to address them by yourself. Please go visit your LCHF doctor. They'll be able to figure out what's happening and advise you from that point onwards. And they may be able to pick up other things that you can't see or you don't know about.
Okay. What if everything is fine? There are no visible markers, all test values are fine. So should I still change my diet? I've had people ask this on our YouTube channel. I'm normal and fine. Should I still change my diet? Should I still change my lifestyle?
Yeah, good. If everything is fine, it means something that you're doing, either your diet or your lifestyle is good, actually. So congratulations, don't worry. Keep on rechecking. Recheck after 2 to 3 years. But if you get any of the visible markers, check immediately. Or if you hit 40 or 45, depending on what your risk-taking capacity or what your comfort level is, check these levels when you reach that milestone. Check every 2 years after that. And if you get any visible marker or a symptom like shortness of breath or a joint ache or any of the side effects of metabolic disease, go and get them checked as soon as possible.
Okay. So how often would you recommend that one repeats these tests?
Okay. Look, if you're doing a fasting insulin and a HOMA-IR test and everything is normal on your first screening test, you can repeat it at 1 to 2 yearly intervals or earlier if you notice any symptoms. But if you're on medications and doctor has made any medication changes, we always would like to check and see what the intervention and the medication has done to you over the 3 to 6 month period. So go back to your LCHF doctor. They will check you maybe in 3 or 6 months to see what benefit we have derived and take it from there. For the triglycerides and HDL, if everything is normal, again, we can check in 1 to 2 years or earlier if you notice any symptoms like a xanthoma or shortness of breath. And again, if there are medication changes, go back to the doctor, LCHF doctor, and they will check you in 3 to 6 months to see what benefit we have derived from lifestyle changes and medication changes.
Okay. Thank you for shedding so much light on the whole testing thing so that we can know which test to take and what they mean for us. So let's go to the next section. And my question here is, how do we improve our metabolic health?
Okay, metabolic health is not something that is an acute event or it's not an infection. You may have acute manifestations in metabolic health, but you don't get a heart attack overnight. It's been happening all through, and it culminates, a metabolic state of illness culminates in a heart attack. So this whole process has been gradual for a long time. So in simple terms, metabolism means just conversion of food into energy or fuel into energy output. Like say we drive a car, you put some petrol, and then that petrol gives you energy. In the same way, the food that we eat, which we put into our body, is converted into energy. And that is how, we are able to do our physical activity. Even at sleep, your body still requires energy to breathe and to pump blood across the heart to work. And many cellular function takes place when you're asleep. So these are the areas which needs to be addressed in metabolic health. What we eat, how often we eat, what are the other supplements we need to eat, physical activity, and sleep. Now I'll go through each one in their individual headings. Content of the food. What we eat determines the hormones that are necessary to convert them into energy. Now a high carbohydrate intake will initiate the secretion of leptin and insulin, and then that insulin and leptin will lead you into a path of constant inflammation. And that's why we want always, as LCHF doctor, we advise reducing highly processed food and increasing the healthy fat, moderate proteins, because these lead to decrease in the secretion of insulin and leptin, hence reduced inflammation. And in the long term, we get a better metabolic health. The next thing is frequency. We as human beings are not created to eat 3 meals a day. That is why fasting is very important. Fasting is there in every culture. The benefits of fasting has been extensively adopted in all cultures from ancient times, whether they knew the pathophysiology or the benefits on a cellular level, they still were able to appreciate the benefits that came from fasting, and they put it into their culture. So intermittent fasting is very important in maintaining a good metabolic health. And along with that, we need to have micronutrients like magnesium, calcium, selenium, things like this, so that you can get from any basic supplement. Physical activity. Movement is life, life is movement. So you need to do some form of physical activity on a consistent basis to maintain good metabolic health. And sleep is very important. A very good restorative sleep is good for hormonal regulation and for avoid many conditions.
Okay. So suppose one is already on medication. Is it possible to wean off medications and become predominantly medicine-free on a daily basis?
What medicines are you talking about? Which?
No, like on a daily basis, stuff that we have to take for chronic illnesses, chronic medication. Is it possible to become free of those medications?
Yes, with the guidance of your LCHF doctor and based on your own motivation to get off those tablets, it's perfectly possible adopting a good, healthy LCHF diet to come out of your diabetic medications, reduce or even completely stop your statins, come off your antihypertensive medications you take for high blood pressure. They are all definitely possible. These conditions are reversible.
So now we'll go on to the next section about immunity. My question here to Dr. Vivian is, how can we improve immunity? Considering the present world pandemic situation, see, some people, they didn't even have symptoms, they got over it. Other than the test, they didn't even know they had the disease. It didn't even affect them. Some people got off lightly, just a slight cold, and they were normal, loss of taste. They were normal after a few days. Some people were affected moderately. Some people were affected very badly, and some even succumbed to it. Some died because of it. And some people who did not die immediately of the COVID infections and its associated diseases lived for some time, but then, developed further complications and died from something else later on, just in a gap of a few weeks or few months. So why was it different for different people? And how do we improve our immunity? How is immunity connected to our health? Are these two different things? Is health, metabolic health and immunity different, or is there any relationship?
If you look at all metabolic syndrome conditions, say insulin resistance or cardiovascular diseases like plaque formation, they're all associated with inflammation. Inflammation is the root cause of all of these problems. So if you reduce your inflammation, your body's innate immunity increases. So if you want to increase your immunity, it just goes without saying that all you need to do is to increase your metabolic health. We saw that metabolic ill health is inflammation. So metabolic health means a reduced state of inflammation. So your body is in a state of reduced inflammation. It's not on a baseline inflamed level. Traditionally, we all know that diabetes is considered as an immunity reducing condition or an immune compromising condition. People get frequent infections. Now, this is because there is an underlying inflammation happening in the body. The body is always inflamed, and insulin causes inflammation. And that is why we say all these metabolic conditions are inflammatory conditions which reduce your immunity. And if you want to increase your immunity, reduce the inflammatory metabolic conditions. If you maintain your body in a state of low inflammation, when you face an attack from another infection or inflammation, your body is well placed to deal with that. But if your body is already in an inflamed state, when something else comes, like say the present COVID-19, which is also an inflammatory process, you get a heightened inflammatory response in your lungs. And that is what put so many people in ICU, and people have lost their lives because of this inflammatory process in their lungs. So it's always better to maintain on a normal day a level of low inflammation, which translates into adequate immunity. All metabolic syndrome conditions like insulin resistance, cardiovascular diseases, plaque formation, and cancer, they're all associated with inflammation. Most people wonder what they can take to maintain a good level of immunity. And as I said, a good level of immunity doesn't come overnight. It is built into your body over a longer period of time. So taking adequate supplements, even when you're well, will meet the micronutrient demands of your body. And we may not be able to get all the micronutrients in today's fast-paced world with a variety of dishes. So it is better, and I'm here not promoting one supplement over the other. There's no conflict of interest here. You're welcome to take any multivitamin supplement that you can find. I would also at this time suggest bone broth. Bone broth is a very good source of calcium and magnesium, which are very important, as we all know, for development of muscles and bones and teeth. Heart muscles are also benefited from the good calcium and magnesium. Cartilage in the bone broth contains chondroitin and glucosamine that is very good to reduce inflammation in joints and bones and give you better outcomes in terms of arthritis in the joints. The collagen and gelatin are very good for skin and connective tissue and also for the alimentary canal. The gelatin has a lot of amino acids, especially glycines and proline. They're all important in wound healing and muscle regeneration, growth and repair. Also, a good exposure to sunlight And, vitamin D synthesis is good, as is physical movement, exercise, and a good sleep.
Now it seems like the virus is not going to leave the planet and there may be another wave. Or like Dr. Beda Stadler says, this may be seasonal, so maybe we are going to get it in the next wave or something. Then it looks like improving our metabolic health is the only way to improve our immunity and protect ourselves from getting the infection, or even if we do get it, we don't have too many bad outcomes. It just becomes like a normal flu virus, like a normal common cold. What do you think about that?
You're very right in that surmise. The statistics from the last 2 years have one thing in common: COVID and diabetes, COVID and obesity, COVID and respiratory illnesses, COVID and cardiovascular disease. They don't go well together. They're a deadly combination, and mortality rates in these groups are very high. And it just increases if you have a combination of these conditions. So it is always better for us to reverse and not be in this place. I think this is a good incentive for people, really take good care of their health and reverse their conditions and regain their health. There is no better time than now to take these conditions seriously. I would definitely caution against complacency in the form of, I have diabetes, my doctor has given medications, the blood tests are normal, and I'm just going to live the same way. But with COVID, diabetes is deadly. So it is better to be equipped before another wave hits us.
Some people, think, okay, we can just continue eating as we are doing now. We'll have highly processed carbohydrate, high levels of carbohydrate, and then refined seed oils, unhealthy fat. And then suddenly trying to improve their immune system by drinking some magic potion, this magic pill, this herbal supplement. So, there are a lot of these things on the internet saying, just this alone will help you increase your immunity. I mean, is that even possible?
Even normal logic would dictate that stabilizing and strengthening the immunity should happen not in terms of disease conditions or not when our body is fighting. These all should happen when we are in normal health to fortify ourselves against such attacks. So it's better not to eat foods that cause inflammation on a regular basis. And then when an infection or an inflammation happens, you are better placed to deal with that. It's like, strengthening your border forces or your defense forces before the enemy attacks. We don't go and scramble for soldiers after the attack has started. We always put our soldiers in the front line, even in peacetime. So preventative measures are more useful than trying to increase our defenses during an attack. That's the time when the person is at their weakest. That is not the time to be, improving your immunity magically. Long-term, consistent efforts to minimize inflammation is good for the body. You can't improve immunity and metabolic health overnight. It has to be a long-term exercise with healthy food, exercise, and good choices.
So for the long term, like Dr. Hippocrates said, let food be your medicine. Seems very valid.
Yeah. More so, let not medicine be your food. I've seen people taking 15 tablets just to stay alive.
Let food be your medicine and let not
medicine be your food. Yeah.
We may all need acute medical intervention. We may all need to visit the doctor in some point of time, but it is possible to be without chronic medication for the rest of our life.
Anybody can fall and suffer a fracture. You need a medical intervention, a surgery or whatever, and your body needs to undergo a process of healing. Now, this healing is always better if your metabolic health is good, because all the resources that the body needs are channelized towards the healing. They are not, distracted with trying to deal with cardiovascular disease at one side and insulin resistance and diabetes on the other side, and a fracture or an infection on the third side. Your resources they are scattered. You don't have a concentration of resources, especially in the healing process, going at one place. So I would say it is always better to be in a good place to then have acute conditions like that hit us. Our healing process will be quicker and more efficient and more predictable, leading to a good outcome at the end.
Oh, that explains why some people got off very lightly. It was just like a normal cold because the body wasn't fighting other things. It just fought off the viral infection and they got well in a couple of days or so. And some people, their immune system fended it off at first attack. So they were healthy. Okay, that your answer now lends clarity to why that happens with some people. Now we get to the next section, the health of the next generation, the health of our children. Suppose a similar pandemic hits the planet 30 years later. Will anything I do now help my children then? I'd like to know if what we feed them now affect their health later on when they are adults. Because as parents, we are the ones responsible for it.
Yes, Tina, definitely. That's one of the most worrying and frightening and concerning things is the increase of obesity among children worldwide. One thing to note here is childhood obesity is directly related to adult obesity. So a child who's obese is likely to become an obese adult. One of the main causes for increased obesity is the increase of refined carbohydrate kids have these days. It is directly proportional to the rate of obesity. Moreover, COVID has reduced the children's physical activity in school grounds and lockdowns and restricting them to the home, reduced exposure to sunlight, video games. It's all a very unhealthy combination for a child. Children should spend more time playing. Physical activities have a huge impact on the metabolism. Reducing the processed food, avoiding sugar and sugary products like fruit juice, biscuits, unnecessary snacking. Portion sizes nowadays are so huge. When I was a kid, when I had a soft drink or something, I clearly remember the size of the bottle. It was only 200 milliliters. Then when I was in med school, it became 250. Then it became 300. Then it became 500. Now you go to a cinema or a shopping mall, you get drinks that are this big, 600 to 700 ml of sugar-laden drinks. And when you take fruit juices, the amount of fresh fruit that is needed to make a 500 ml jar of, say, orange juices, you at least need 15 to 20 oranges. And no child would eat 15 to 20 oranges as a snack. These are all problems that our children face now. So we have to reduce the sugar intake, reduce refined carbohydrates, increase the protein and good fat, eat whole foods, good foods, real foods, not processed foods. It's better that the foods are home cooked, spending time playing and increasing their physical activities. These will go a long way in these kids to set them up for a future of good metabolic health.
Okay. Nowadays, the proportion of overweight children to what was there 40 years ago or so is very different. We come across many more overweight children than we did when we were children. For example, in my class, say of 50 students, maybe 4 or 5 children were overweight. But now in a class of 50, at least around 25 children are overweight. We just see more overweight children in public places. We come across more overweight children. And even children seem to have acanthosis nigricans, and they're just visibly fat. They're not able to play, like they're not able to join a football team in their school, and they're not able to play physically. They're not able to have much physical activity. So in the case of such children who are already sick, would a regimen leaning more towards health CHF be helpful for them to become healthier? What would you suggest?
Look, kids are so active that they do not follow a very strict LCHF diet like the adults. In saying that, change of food will definitely reverse the problem now and set them up for a good future. Kids, they are not the ones who go shopping and buy the food. It's the parents who do the shopping. So the parents should be conscious of what they should buy and stock the pantry for what the kids need to eat. The kids only eat what is available. They just go and open the pantry and then they just put in their hand and get out what is there. So I think the responsibility of making healthy food choices rests with the parents, not only with the children. So it's very important to educate, especially with the food ingredients. And then along with that input, the kids can then be empowered to make healthy food choices. And it is very optimal for a child to visit their GP once a year to do measurements, abdominal girth, their height, the waist to height ratio. It is better to assess the problem in their earlier stages, better earlier rather than later, because any intervention later could reverse your metabolic health, but the psychological side effects from obesity for the kids is also very real. We do not want to stigmatize our kids, but society will do it sooner or later at some point of time. And they may not be able to participate in sports. They may not be able to, get into a jumping castle, or so there may be weight limits on certain rides and many things where their weight may not allow them to participate in certain activities. And they're going to be upset then. We rather address this problem earlier so they are not put in a place where they get excluded because of obesity and overweight in their later years. When we talk about kids and kids' obesity, it is not about ostracizing or shaming people. It is just an intervention to make them healthier.
Obesity is not an appearance issue. It's a health issue. So we have to, as parents, think about, how we can better the health of our child instead of taking it as an identity issue and getting affronted. We then, we say, okay, my child is overweight. This is going to affect my child's health in the future. How can I correct it now, so that they can have a healthier future and live better lives as adults and live longer and live healthier. And what we feed them now affects their future. Anyway, okay, so let's move on to the next section. This is for elderly people. So how about elderly people? How about senior citizens? I've observed two kinds of mindsets when it comes to elderly people. Those who don't want to change and those who don't know that they can change. So the first type of people I see, they say, no, I don't want to try anything new at this stage. I will continue things as they are. Maybe, things will become better. Or they think, okay, maybe it won't become better, but it will be as it is. I'll maintain status quo. But I want to say here that the reality is things will not remain as they are. If you just zoom out and observe, the past 3 years or the 5 years, past 10 years of your life, you will realize that one problem leads to another, leads to another, leads to another. Because by definition, these diseases are chronically progressing. The disease is progressing. The human body is degenerating. These are degenerative. So there are, one after another health complications day by day because the root cause of insulin resistance and leptin resistance haven't been addressed. So there's a kidney problem, liver problem, non-healing foot ulcers, forgetfulness, dementia, joint pain, muscle pain, bone pain, all kinds of problems keep coming. So I'd like to offer this perspective to people who think that it's going to remain the same, that it may not remain the same. It may get worse in high probability. The second kind of people I feel is people who say, I would like to become better, but I don't know if it is even possible. Is there a possibility for our elders to regain their health so that they don't have to become so dependent on their next generation? What if I get a hypoglycemic episode? They need constant care because one after the other, these diseases have piled up on them. They need somebody to constantly supervise them or be with them, or sometimes they even need to be admitted in a nursing home because home care is not even possible. These chronic progressive diseases have pushed our elders to that level. So there are some people who think, I would like a change. I would like to do something if it is possible to change it. So to these people, can you explain to them whether it is possible, or if it's too old, oh no, nothing can be done, or oh yes, something can be done, change is possible?
Okay, Tina, there are two factors at play here. One is the knowledge and the other is the willingness. To bridge the gap in knowledge, we can tell the elderly things can be reversed. You can have a good, healthy old age. Old age does not mean diseases. Old age can be actually enjoyed. This will address the knowledge gap aspect. So I want to encourage every elderly person that if they decided, it is possible to reverse these conditions and reduce the pain and suffering associated with these conditions. The next question is the willingness aspect, and that needs to come from the other side. Some people are really motivated, and some people, for various reasons, they don't have enough motivation. So to get a healthier outcome, both of these need to be matched. The knowledge gap has to be addressed, and the motivation and willingness also has to be addressed. One without the other will not give you a good outcome. I'm happy to encourage all our elderly people that anyway, there's going to be some discomfort. If you are going to continue in your disease state, it's only going to get worse, more painful, and it's going to be a lot of suffering. So are you willing to undergo that type of suffering, which will have definitely a bad outcome? Or are you willing to do something, take you out of your comfort zone, cause some discomfort, and then give you a better outcome? So at this stage, the knowledge gap is fixed. The motivation can be worked on. It's for them to decide, am I going to suffer and have a bad outcome, or I'm going to go into some discomfort and have a good outcome. That's up to the mindset of the individual person.
That's encouraging to know that there's hope, and if somebody wants to change, then there is a possibility for them to reverse their conditions and live a much healthier and a longer life.
Yes, I have seen many people take up this offer, and we have de-prescribed medications and seen good outcomes. De-prescribed in the terms, de-prescribed in a good manner, not just cut it off because they are in end stage, their life. I have seen people coming off the diabetic and hypertension tablets in their old age.
And this is possible even for, say, for example, a person is taking insulin shots and is on highly diabetic for many years, has had heart surgery and stuff like that. So they think it's very complicated. Is it possible?
It is possible. But it takes some time. It is slowly possible, and it depends on the individual, conditions as well. We can't give a blanket statement that everything is possible for everybody. But with the consultation of a LCHF doctor, it is definitely possible. I do not personally subscribe to the mindset that aging is disease-ridden and disease-prone and a decrease in health outcome. You can age well without chronic diseases.
It is possible to be a golden oldie and enjoy it.
Yeah, definitely. Oh, life is full of them. Yeah.
I'm so glad that you addressed this issue, because this offers hope to a lot of elderly people who might have previously been of the mindset and the belief that nothing can be changed, I'm too old. So at this point, I'd like to quote the example of our mother, Paul and Satyakumari. Her videos are available in the list, The Elderly. She's Dr. Vivian's and my mother. Dr. Vivian is my brother. She decided to make this change after 25 years of progressive diabetic medication and 2 years of statin medications. At one point, she was advised to take insulin shots. At that time, she took this decision saying, by then, my husband and I were 2 years into the LCHF lifestyle. So she said, okay, I want to do this. I'm not going to get insulin shots. I'm not going to make my health any worse. I want to get better. I want to try this. At that time, she was living with you at your home. She was living with my brother, Dr. Vivian, and therefore with his supervision and the consultation of Dr. Vijay Raghavan, she was able to change over to an LCHF food and lifestyle and completely wean off her medications. So I encourage you to watch her videos. She's an example of how one need not be a slave to food and to medicine and, a need for constant company and supervision. There was a time when I used to be afraid of leaving her at home for an overnight trip or something, thinking, what if she forgets her medication, or what if she gets an episode of hypoglycemia and slips and, becomes faint or something like that. So now she's free from all that. She doesn't need to be constantly supervised or need constant company. She's not a slave to constant medication, to looking at the clock and having to have food and medication. She's free from chronic sickness and chronic medication and is living a happy and healthy life. So it is possible to have a healthy old age, not necessarily a sick old age. So thank you for giving our viewers that perspective and that hope. Dr. Vivian, thank you so much for answering my questions and spending time with us. It will be very useful for our viewers to better their health. Any parting thoughts that you may have?
You're most welcome. It was my pleasure to be on this show. Your health is in your hands, and what you put in your hands to take to your mouth. As doctors, we can advise, coach you, and guide you, but ultimately, it is in your hands. All the best for your good health.
Thank you for answering all our questions. I'm so glad that there is yet hope. There is hope. We don't have to necessarily get some chronic progressive disease and die of that disease, but it is possible to have a healthy life. When we are advised to reduce weight, it is possible. Before, Pert said, reduce your weight. And we were advised that in order to reduce weight, we have to eat less, exercise more, calories in, calories out, use your self-control. And in that philosophy, things were not working out. But now when health experts tell us to reduce our weight, it is totally possible and sustainable on the LCHF lifestyle, which is LCHF food and intermittent fasting. So it is very encouraging that we can have longer and satisfactory, healthy lives. There is hope that we can add many years to our life, and we can also add life to our years. Thank you so much for watching. Do write into us if you have any questions or doubt. If you want to know what LCHF foods mean, what are the food items that we can have on an LCHF diet, and to know more about fasting, do visit our website and our YouTube channel. Don't forget to hit the like button if you liked our video, and don't forget to subscribe and turn on notifications. Please do share this video as much as possible. This information and this message of hope that we can live healthy lives and live long is necessary in these hopeless and discouraging times. So please share this video as much as you can. Thank you once again, Dr. Vivian, for being with us and shedding light on so many issues that have seemed so vague and hopeless. Thank you.
Thank you. And again, it's my pleasure.
Wishing you all good health and long life. Thank you.